Thank you, Mr. Chairman. By the way, I didn't know that you were leaving us. So I will associate my remarks with the ranking member and say to you that it is indeed a loss for the Congress and for the sense of bipartisanship, quite frankly, that has really been demonstrated over and over again by this committee. I want you to know that your decision to voluntarily leave is not new. I did the same thing 27 years ago, and look where it got me. So
that crossed my mind.
Yeah, you may be back. For decades, and by the way, I want to also agree that this is a great panel of witnesses, and I appreciate all the work that you've done, all that you're doing, and the many things that we don't know about, because we get an hour here with you or 2 hours there, but your reputations precede all of you, and I'm glad that you're here today. Mr. Chairman, the World Health Organization has helped, as we all know, to build an effective health system and has overseen for many, many years the expansion of healthcare access across the globe, in fact, 75 years. And through this work, the World Health Organization has markedly increased a number of things, not the least of which is the average life expectancy globally from 47 years to 72 years. It is, of course, important for countries that are part of the WHO, such as the United States, to give critical feedback to the WHO on reforms to help strengthen its mission. I mean, we all have some ideas, I think, of what we'd like to see, and that's why I was actually shocked when I learned that the committee was not going to center this hearing around bringing witnesses from the World Health Organization to testify before us, particularly since the title of the hearing is Reforming the WHO. It just seems like we've lost a great opportunity here, and some of the things that have been raised, such as finding a way to reduce, if not eliminate, China's influence, finding ways to have greater accountability, and finding ways to make sure that oversight is fixed and set, seems to have eluded us as a result of this. I strongly hope that the committee will, at some point in the future, consider bringing in representatives from the WHO so that we might, in fact, be able to get to the heart of some of the things that keep us up at night and trouble us when we think about what we'd like to see from this particular organization. Again, I appreciate the witnesses who are here today. There's a couple of things that strike me as kind of ironic, and I believe, Mr. Chairman, that the horse just got out of the barn, that some of this stuff that we are reacting to, it was really the role of this Congress and the previous Congress to get in front of, and that did not happen. So we're playing catch-up. We're mopping up the floor. In some instances, we are assigning blame, but the real blame, I think, here is in the Congress for not providing the proper oversight from the time that the pandemic hit. And I agree, it was a difficult time for all of us then, but you know, we ought to be a little careful about warning reform without being able to identify the reform that we want. This year, several members of the other side of the aisle are offering amendments that would eviscerate, gut, and do away with, quite frankly, the World Health Organization. I have before me H.R. 1546 to prohibit the use of any and all funds to implement any obligations of the United States under the World Health Organization Pandemic Treaty. H.R. 79, a bill directing the President to withdraw the United States from the Constitution of the World Health Organization, and an amendment to the labor HHS appropriation that says none of the funds made available by this appropriation shall be made available to the World Health Organization. I would ask unanimous consent that they be entered into the record.
Without objection.
So this is a very serious situation. I'm going to come to the Assistant Secretary, Ms. Pace, in just a moment, because she said something that struck me, and that is that if there was no World Health Organization, we would have to invent one. And I agree with that totally, much as was the case in 1948 when countries around the world really understood the need to find a way to collaborate together. And I would ask Ms. Pace, as Assistant Secretary, if you had your way in a magic wand, since we don't have the WHO here to talk about reforms that we think and they think might be needed, what would be one or two of the things that you would suggest for the consideration of this committee?
Well, thank you for that question, Mr. Congressman. I appreciate it because we do want a WHO that is effective and truly in service to the world. I also want to reflect on what we've offered as highlights on what the WHO has done right or well. It is not just smallpox or polio that are its success stories. In fact, many of its success stories in global health security, as we call it, are even seen and heard today, only they don't make headlines because of that very success. So whether it's with regards to Ebola or Marburg outbreaks, which we've all experienced and worked with WHO to address in the past couple of years, or even in longstanding programs such as childhood immunizations or maternal care around the world, addressing maternal mortality and other really important issues such as AIDS, TB, and malaria. This is the work of WHO that even helps to complement longstanding U.S. programs. The fact is we cannot be everywhere as a country, nor should we be. We cannot be the World Health Organization ourselves, and so we rely on this multilateral institution to work or partner with us and leverage our resources so that they and we collectively can have that much greater an impact.
Thank you very much. My time has expired. Thank you, Mr. Chairman.
I just want to point out that the WHO and other international organizations are immune from congressional testimony. That doesn't mean we can't reach out to them directly in a less official way.
Yeah, because I'd like to
We're
know what
planning
they
that.
think their reform should be.
And we're planning that.
Okay, thank you.
Yeah, thank you.